This film supplements the instructions for use and serves to aid understanding. This film is not a substitute for reading and understanding the instructions for use. It is also not a replacement for mandatory instructions or training courses. The Dräger Oxy SR series contains oxygen self-rescuers that protect you when escaping to a safe area. The self-rescuers are part of the personal protective equipment that protects you from inhaling harmful substances from the ambient air or from oxygen deficiency. You can choose between devices with different rated duration times. In the following, we will explain the donning procedure for the Dräger Oxy series. It is identical for all Dräger Oxy SR and 3000 and 6000 variants. As long as the self-rescuer is stored, no inspections are required. In all other cases, the inspections must be carried out according to the table in the instructions for use. Make sure that the unit is clean for inspection. Units with intolerable deformations must be sorted out. A corresponding guide is enclosed with the instructions for use. First, check attached accessories, such as the support ring. This must fit snugly against the lower part of the housing and be engaged. The shoulder strap should not be frayed or show any other damage. Then check whether the specified service life of the unit has been exceeded. Check the indicator window and the seal for damage and replace if necessary. Furthermore, the lid must be closed. Therefore, check whether the opener is locked and undamaged. Finally, check the indicators in the safety eye. If moisture has entered the self-rescuer, the moisture indicator turns from brown to turquoise. However, the O-ring around the moisture indicator may be turquoise, and in this case does not mean that moisture has penetrated. If a heat indicator is installed, check that the color of the heat indicator in the center is black. If the unit has been exposed to excessive heat, the color of the heat indicator changes from white to black. If the humidity or heat indicator flips during the shift, the unit can be used until the end of the shift and only then must be taken out of operation. Finally, check whether many yellow fragments are deposited in the area of the viewing window by shaking the unit. This indicates a mechanical overload of the unit. In this case, the unit must be discarded. When you carry the unit with you, you have the option of adjusting the carrying strap to suit your needs. Pull the opener and bring it to the end position. The retaining straps and the seal will fall off by themselves. Reach into the opener and remove the upper part of the housing. Let it fall. Opening can be assisted as follows. Lay the unit flat on the floor and press on the edge of the upper and lower parts of the housing to bend the housing at the level of the ceiling line. Use the yellow straps to pull the oxygen self-rescuer from its housing. Hold the device by the neck strap and put it around your neck, making sure the breathing bag is pointing away from your body. Pull the mouthpiece towards your face and put it immediately into your mouth. This will release the starter. The mouthpiece must sit between the teeth and lips. Also, make sure that the tube is not twisted. Put the nose clip onto your nose. You should no longer be able to breathe through your nose. The tight fit is crucial here, as otherwise the starter oxygen could be released and ambient atmosphere could enter the unit. You are now sealed and can exhale. The oxygen from the starter flows into the breathing bag within the first few minutes. However, the breathing bag does not fill completely. The deployment of the breathing bag can be assisted with the hands if necessary. If the starter does not deliver the oxygen, or you and the device are not properly sealed, exhale forcefully from the ambient air into the mouthpiece 2 to 3 times to fill the breathing bag. The chemical reaction of the cartridge takes a few minutes. This is indicated by slow warming of the heat shield. The breathing bag then slowly fills over the usage time until the full volume has been reached. Support the bottom of the self-rescuer and pull on the end of the neck strap in order to draw the self-rescuer upwards. Position the device in front of your chest so that you can move your head freely without pulling on the mouthpiece. Detach the protective goggles from the device and put them on. Lastly, wrap the chest strap around your body and fasten it. This prevents the functional unit from moving. You can now escape from the dangerous area. Pay attention that the mouthpiece is firmly seated between your teeth and lips and tightly enclosed by your lips so that no harmful substances from the environment are inhaled. You must not speak during use. The nose clip must close the nose well so that no pollutants from the environment are inhaled. The air from the self-rescuer is warm and dry. This condition starts slowly and increases continuously. This is a sign that the self-rescuer is working correctly. Any taste of its own is also normal and harmless. The breathing bag must not be damaged or compressed, otherwise vital oxygen will be lost. In case of vomiting, do not vomit into the self-rescuer. Remove the mouthpiece from the mouth and close it with the thumb in order to avoid inhaling air containing harmful substances from the environment. Inhale from the self-rescuer first after reinserting the mouthpiece. Observe the usage times specified in the instructions for use. The oxygen supply runs out when breathing becomes more difficult and the breathing bag starts to collapse. If it is necessary to put on a new self-rescuer, proceed as follows. Tighten the chest strap of the old self-rescuer. This ensures that the functional unit stays on the body. Take a new self-rescuer of the same series, otherwise different donning instructions apply. Carry out the first steps of donning, such as opening and removing the functional unit, as previously described. Open the buckle on the neck strap of the old functional unit. The unit is held in front of the chest by the chest strap. Continue breathing out of the old functional unit. Now place the neck strap of the new functional unit around your neck. The following steps must be done quickly, as you are inhaling from the old functional unit for the last time. Remove the old mouthpiece and nose clip and drop both. Pull the new mouthpiece towards your face and put it in your mouth. Immediately put on the nose clip. The nose must be sealed. Now breathe with the new functional unit. Loosen the buckle of the chest strap of the old functional unit. The unit will then fall off the body. Position the functional unit and carry out the last steps of the donning process as described in the previous chapter. Now you can safely and calmly escape from the danger area. Not all products, features or services mentioned in this video are available for sale in all countries. Contact your local Dräger representative for more information. Mentioned trademarks are only registered in certain countries and not necessarily in the country in which this material is released. Go to dräger.com/trademarks to find the current status.